Welcome friends, welcome to Master Stroke. I am Dr. Indu Arneja, a psychologist and a passionate trainer in communication in healthcare. As you know, we have been conducting multiple programs all across the country about communication among healthcare professionals. In the series of the same effort, we are trying to now create a dialogue between the medical professionals and society. So in an attempt to make a beginning, I have with me Dr. Parveen Bhatia, who is a laparoscopic and robotic surgeon at Sir Ganga Hospital and Bhatia Global Hospital. Thank you so much, sir, for agreeing to be with me on this platform, because I know it's something that we are starting with a new idea, with a new vision, and I hope this will bring some change in the understanding among both the parties, among the medical professionals and society on the whole. So before we start with the program, would you like to say something?
Sure. I must appreciate the effort done by Dr. Indu Arneja on doctor-patient communication. What I mean to say that she has been traveling all over the country to speak in various fora about the gap which is present today and which is widening day by day. I think you are making a difference and you are making a great impact on the doctor-patient relationship. So I wish you all the luck for such a venture, and let us make an dent on the globe by improving doctor-patient relationship.
Thank you so much, sir, for your words. They really mean a lot to me. To start with the discussion that I wish to have with you, my first question to you is, what has changed in the doctor-patient relationship? What it was when you started your practice way back, maybe in which year did you pass out?
82.
Oh my goodness. Oh, it's an era, I could say. So what has changed? What was earlier and what is now?
I think the most important change which has occurred in last 3 or 4 decades is trust.
Yes.
Initially, all of us have enjoyed the trust reposed by the patients on the doctor, but now, because of many reasons, society reasons or interpersonal trust or so many reasons, the trust has changed, and that is I would say the point which has to be brought back in order to win that kind of equation in doctor-patient relationship. Patients used to trust first the God and then the doctor.
So true.
But now they feel that it has been commercialized to such an extent that we are paying money to a doctor, and if the doctor is rendering services, it's fine. So I think that equation has to be changed, and you are making an impact, and you should carry on doing such kind of exercises so that now the difference comes back. That means people start trusting on each other as well as on the doctors also.
So true, sir, so true. I think that's what is the purpose of these programs. For example, like you have had your medical education in a government hospital. Even your post-graduation is from a government hospital, a very busy hospital. How did you manage to honor that trust that the patient has in you, and also maintain your relationship with the patient so that you come back satisfied after you working with them?
I think the answer to is attitude. If you are working in a government setup or if you are working in a private setup, if your attitude is like that you want to reciprocate or you want to treat the patient as your own brother, sister, mother or whatsoever, then only if you are working in government hospital, yes, I know that workload was there in way back in 1992, 93, lot of patients used to be in the OPD, but if your attitude is of helping them in whatsoever small manner, that will always bring happiness, and one should try to spread happiness as much possible as rather than posing your stress onto the patients, which is not desirable at all.
Time has always been a constraint. I'm sure in government sector, because the workload is a lot, And in private sector, because we have a lot of expectations to be fulfilled and a lot of responsibilities to be fulfilled, how do you manage this time factor way back in 90s when you were in the government setup and now in the private sector?
I think time is a mindset, and one has to spend quality time. And we don't have, any beggar and billionaire has 24 hours. So one has to know that how to spend the time wisely. So if you are spending time with the patient, make sure that there is a purity of attention. That you are talking, for example, you are talking to me, I am talking to you. I am not distracted by other things. So thinking is that if you are talking to a patient should also feel that you are giving that minute or second or 3 minutes or 4 minutes to the patient, to the welfare of the patient. You are seeing all the reports and then you are giving your final verdict rather than just talking on or busy on phone and checking your WhatsApp or showing the videos to the patient on your laptop, which the patient may or may not understand. So our thinking is that eye-to-eye contact, attitude of gratitude, that has to be there. If the patient is happy, we are happy, and that way we can spread the happiness.
So true. I went through a number of studies. I was trying to see what is the time the patient expects from you and how does that impact the patient satisfaction. You'll be surprised to know that studies suggest it is not the amount of time, but it is the quality of interaction, what you were just mentioning.
Absolutely.
In those 2-3 minutes, if you are able to give this feeling to the patient that I am 100% attending you and I am thinking very seriously about you and I am concerned about you and I want best for you, patient goes back very happy. They don't expect a doctor to spend maybe 15 or 20 or half an hour because they know everybody is busy, so nobody will give so much of time. But the quality of interaction, how you make them feel, how you look at them, how you even offer them seat or smile, these things I think compensate for paucity of time.
Sure.
And especially in a government setup like this. What is your opinion about
I would second that, and I would say that at the end of the consultation, one should always ask the patient, and I always do it, that have you got any questions? I always ask the spouse, I always ask the brother, sister, or whosoever attendants have come with the patient, that have you got any questions? So that they feel that yes, doctor has told us anything and everything about our disease, about the patient, and then he is also again asking that if any unanswered questions are there, that can be answered. So that kind of satisfaction level has to be attained in order that patient goes satisfied, and then obviously he or she comes back and brings more patients.
I think one more change, I'm seconding to what you are saying, one more change that has occurred in the last few decades is patients and their family member actually never asked. They hardly asked anything, they just completely trusted, and whatever doctor said, they just followed. So it was more like a paternalistic kind of relationship with the patient, that I will decide on your behalf and whatever I say you have to follow. Today, patients want to participate in decision making. They want to know what is happening, what are the options available, can I delay the surgery, can I get this surgery done, can I get this treatment, or whatever their questions are. So definitely now answering those questions, addressing their concern becomes all the more imperative in such a kind of a setup. And that's probably the biggest reason for patient satisfaction also.
Sure, I would put it this way, that today I respect Dr. Google. Dr. Google, the patients see and go on internet and see about the disease, but they may be seeing lot of things which are not required. But it becomes easier for me to interact with them because they know some bits of it. And then many doctors I have seen, many doctors get annoyed when the patients start asking the questions from Google or from the internet. But I think one has to respect that we have progressed to that level. We cannot reach any destination without the GPS. So thinking is that if we see the GPS and reach the destination, why should we not help the patient also go into the net, see the positive points, and then ask the questions so that all of us are on the same platform. That is important.
I think I am surprised by your answer, honestly, because I have asked these questions n number of times in my training program. Mostly the response I get from the audience is they are very resentful.
Sure.
Because patients are, they read and come back, but it's a very nice way of looking at it. If they read and come back, my task becomes easier,
and then I can go 3 steps further. If they ask me, sir, will there be any recurrence after hernia?